So hello everyone, and thank you for joining us for this by name list and coordinated access community of practice call to learn more about the work that is taking place in St. John, New Brunswick. St. John has had a quality by name list since December of 2019. They confirmed a veteran quality by name list in October of 2020, which was the same month that they confirmed a 10% reduction in chronic homelessness. So this is a milestone that they are continuing to sustain. They are then confirmed for the reaching home level of coordinated access in February of 2021. So all of this really demonstrating their perseverance despite COVID. Today, St. John will provide an overview of their coordinated access system with a focus on access points, their housing focused approach, and their In From the Cold campaign that took place this last winter. We will begin with a land acknowledgement, and I invite you to take this opportunity, if you haven't done so already, to put your own land acknowledgement in the chat. From coast to coast to coast, we acknowledge the ancestral territory of all the Inuit, Métis, and First Nations people that call this land home. I am located in Kitchener, Ontario, which is situated on the traditional lands of the Anishinaabe, the Haudenosaunee, and the neutral peoples whose presence on these lands continue to this day. And my name is Marie Morrison. I'm the Director of Built for Zero Canada with the Canadian Alliance to End Homelessness, and I am your host for today's webinar. Our presenter today is Michael McKenzie, who has a master's degree in political science and almost 10 years experience as the Human Development Council's lead system planner. Michael brings a wealth of understanding and appreciation for how best practice can be tailored to benefit under-resourced communities, keeping a constant eye towards policy level improvements. He has not only helped multiple communities in New Brunswick implement coordinated access system, but has also worked with provincial and municipal leadership to address the gaps and barriers that the most vulnerable citizens do face. And I've known Michael for many years and have very much appreciated working with him and appreciate you being here today and preparing this presentation. Very excited. Just a little bit of housekeeping before we get going, just to say that the Canadian Alliance to End Homelessness is hosting these webinars and leads a national movement of individuals, organizations, communities working together to end homelessness in Canada, and works on these 6 key initiatives that you see here. This by name list and coordinated access support for communities is funded in part by the Government of Canada through the CCI funding stream of Reaching Home. This webinar is part of a monthly series of webinars and community practice calls that have been going on through the Alliance since the fall of 2019 and are wrapping up in March of 2022. The calendar for January to March has been released. You can find all the webinars and community practice calls, both those coming up and previous ones, on the CEH Training and Technical Assistance website. Little bit of housekeeping just to say that today's call is being recorded. We will send out the recording and the PDF of the presentation within a few days to all those who have registered. We'll also be posting on that website that I just showed you under webinars, under archive webinars. I am going to be enabling closed captioning, and then you can choose to view that or not. Everyone is muted, and please use the chat and the question function to make comments or ask questions throughout. So welcome. And with no further ado, I am going to turn it over to Michael.
All right, thanks, Marie. So I'll just start as well by situating myself as being on the traditional unceded territory of the Wolastoqey, Mi'kmaq, and Pescataway people in what's now known as St. John, New Brunswick. I also want to start by thanking the Canadian Alliance for asking St. John to be part of this webinar. Originally, I was going to be joined by our BNL coordinator, Kathy Foote. Unfortunately, for all of you, and Kathy's moved on to another position, so you're stuck with me today. So I hope for no hard questions at the end of this, because Kathy really was the smart one of the group. But I'm pleased to be here to talk a little bit about coordinated access in St. John, to provide an overview of the system, And I will focus a little bit on access points because that's something that we've had challenges with and that we continue to test out new strategies in terms of getting people into the system quickly. So I'll talk a little bit about that. And then in the second half, I will focus more on the housing-focused approach that St. John has really adopted over the past few years, which will lead into an overview of a campaign that we conducted recently called In From the Cold, which was an effort to accelerate move-ins through coordinated access in order to avoid opening it out of the cold shelter. And that took place just before Christmas. So to start, as I mentioned, I'll just give an overview of our coordinated access system, which is called the Homelessness Information Partnership St. John, or HIPSJ for short. So I thought I would essentially just walk through our flowchart that we developed for the system. As I mentioned, I'm going to pay particular attention to access points because that is an area where we're seeing a shift and where we either have or are trying a number of different strategies to get folks into the system quickly without overburdening the frontline agencies. So I'm going to come back to the access points, but I'll essentially just take a few minutes now to walk through the rest of the system. So when someone arrives at an access point for HIPSJ, we ask agencies to practice a 14-day diversion period if the individual is newly experiencing homelessness. I think this is fairly common now across the country. If it's a situation where the individual is either at risk of losing their housing or has just recently lost their housing, we would refer that person to prevention or diversion services. So in St. John, we have an agency called Fresh Start that is funded by Reaching Home to provide a prevention program. And then we also have Outflow, which is our men's shelter, and that operates a diversion program that's also funded by Reaching Home. So these are formalized programs, they are fully funded. But even for agencies that don't have funded programs or formalized prevention diversion programs, we always encourage folks to exhaust every other opportunity prior to adding someone to the BNL. And so we actually include a screening tool that's on the screen now. This is at the beginning of the BNL intake form, and it's really to ask the person who is making the referral to consider whether this is a necessary step for the individual that they're working with. This is in part because we've seen in the past a lot of referrals from or of folks who are precariously housed, who might be in transitional housing or something like a rooming house. So certainly not in necessarily a stable situation, but also not actively experiencing homelessness. So we provide this screening tool and ask people to ask questions like, does this person have their own key? Can they stay where they are as long as they want? If there's a cost associated, are they able to afford it? And if you answer yes to more than one of these questions, then the BNL might not be the appropriate referral source for this individual. That's not to say they don't need another referral source, but we would point more to prevention or diversion. So, of course, if someone is experiencing homelessness and the 14-day period of diversion has elapsed, we would, of course, ask them to conduct an intake and refer someone to the BNL. This is all done online, and our coordinated access facilitator would receive those referrals and add the individual to the BNL. Currently, the BNL is housed in Excel, so this is all done outside of Hyphas, but we are in the initial stages now of transferring to coordinated access within Hyphas, and that's going to be a bit of a process for us. It's going to be over the next year, but currently that still is an Excel spreadsheet. In addition to the BNL intake form, we also ask that a SPDAT be completed. And I'm sure everyone probably is familiar with SPDAT, but it stands for Service Prioritization Assistance Tool. It is our common assessment tool in St. John, developed by code. It is the situation where there are time constraints or a lack of capacity, or potentially the person referring the individual is not trained in SPDAT. We do also accept a VI SPDAT, but we really encourage full SPDATs to be done whenever possible. I would also note that once someone is added to the BNL, their SPDAT score doesn't actually affect their prioritization on the list, but it helps to determine what level of supports they're going to require. So when we're generating a priority list, so for example, for a Housing First program, we would be filtering the list based on folks who are high acuity, who are chronically homeless, as the eligibility criteria for a Housing First program. But then within that cohort, prioritization is determined by other factors like living location, health conditions, factors like that. So that's essentially how folks are added to the BNL and how they're prioritized. Vacancy matching and referral takes place at our HIPSJ governance meetings, which we used to call our BNL meetings. So these are, we discuss policy, but we continue to do vacancy matching and referral at this table as well. But it only identifies available units, including details like where in the community it's located, is it an accessible unit, is it pet friendly, things like that. And then matches that unit to a program that has availability on their caseload. So assuming we have an available unit that is brought to the table, and the Housing First program, for example, has room on their caseload, we would match the Housing First program to the unit, and that program would receive the priority list at the end of the governance meeting. So they would receive essentially the top five, the five most highly prioritized folks at that time. Anything related to client discussions or client details, that's all handled at case conferencing. And that would include reviewing the priority list for the Housing First program to identify ultimately who will receive a housing offer. I should also note that nearly all of the matches that are done through coordinated access are with the support of a rent supplement from New Brunswick Social Development. This is something that over the past year and a bit, there's been an effort to include more non-subsidized affordable housing units, but market rental units, but they are few and far between. So at this point, still most if not all of the matches being done through coordinated access are for subsidized units. So that's kind of very quickly a summary of how the system works. I just want to go back now to access points. So for most of the 3 years that HIPSJ has been in place, this is essentially how the access points have looked. 4 primary access points and a number of secondary access points. The primary access points being secondary access points being non-homeless specific providers or agencies where nonetheless someone might be experiencing homelessness. So once we have Horizon, this is our health authority. So at something like the hospital or at a federal correctional facility in St. John, if someone is being discharged trained on SPDAT and for BNL intakes, and so they would actually do the BNL referral for those individuals prior to discharging them. Obviously, our preference is always to do a bit more discharge planning that results in housing and not referring someone to the BNL. But if they will be discharged into homelessness, we prefer that they do the intake themselves. Of course, we would never refer someone to the hospital to have an intake done, but it's more to relieve some pressure from the primary access points.
Michael, just so you know, your sound is
And
cutting.
that's something that we have struggled with.
Your
is
sound
it?
is your sound is cutting in and out a bit. So I would just suggest maybe stop sharing your camera, and that might help with the Wi-Fi.
Oh, sure. Okay, so yeah, as I was saying, the secondary access points were really an effort to relieve some pressure from the primary access points. And we have seen since the beginning of our coordinated access system bottlenecks at those primary access points. So we are always testing out ways of relieving some of that pressure used or are currently using on this slide as well. So through the pandemic, we created kind of a short truncated version of intake, allowed intakes to be done over the phone, obviously with a lot of the work that was happening throughout the pandemic as we moved to more virtual options. We have also partnered in the past with the University of New Brunswick and St. John to have nursing students who are trained on SPDAT and BNL intakes to actually go out to the access points and do those intakes and assessments. We also have, through the Human Development Council website, we have a coordinated access section where not only can you find the process guide and flow chart and the screening tool that I showed, as well as some other resources, but through a link on that page, you can actually refer yourself or someone you know who's experiencing homelessness to be added to the BNL. And you can also submit client updates through another link as well on that same page. So this is something that we continue to work on. It continues to evolve. One of the major changes that's coming down the pike, obviously, is the shift to coordinated access within Hyphas. And so with respect to access points, we're now having conversations about how many agencies will need to be onboarded to Hyphas. Might we need to invest in a full-time position that essentially acts as a mobile central intake point? These are all the types of questions and conversations that we're having now. So that gives, I hope, a general sense of how the system functions. I also wanted to highlight, as Marie mentioned, the extent to which the community, and by that I really mean the frontline agencies that we work with, have adopted this relentless commitment to being housing focused. And I'm sure this is something that others on the call can relate to. I hope it's something that others can relate to, but it really, I don't think, was something that we had thought all that much about until when we were asked to do this webinar, and we happen to be in the midst of a campaign called In From the Cold, which we'll talk about in just a couple minutes. But thinking about it, I thought it might be helpful to kind of go back to when we were launching the system, because I think this was really a formative time for our community in terms of adopting a housing-focused mindset, as well as some other key mindsets that have kept us on track and led to some of the success that we've seen in the past couple of years in terms of reductions in chronic homelessness. So it was November 2018, if people can go back that far, pre-pandemic. We were seeing, as often happens at the beginning of winter, visible rough sleeping and by the general public. This was happening in St. John, Fredericton, Moncton. And so as the community entity, the Human Development Council, we knew that something needed to be done. And so we called an emergency meeting of the Community Advisory Board to discuss what that might be, the assumption being that it would be an out of the cold shelter. As it happened, this also coincided with an event that we were organizing called a Barrier Busting Bash, which was a day, it was a long event where we were bringing from in the homelessness sector, Social Development, Service New Brunswick, who would issue identification, from the Health Authority, the municipality, the energy utility, Veterans Affairs. So all, a really diverse group. And what we did was walk through an experiential learning exercise where we asked people to put themselves in the shoes of someone experiencing homelessness and to try to navigate this system that included getting identification, setting up a bank account, accessing housing, for all the index and assessments that they were forced to go through, and just show how difficult it was to navigate the system that did not act in any kind of coordinated fashion. And obviously, this is all pointing to the value of a coordinated access system. So we planned this event. We had it, and immediately following that, we had our emergency meeting of the community board, discussed what we would do in response to rough sleeping and the approaching winter. Going into that meeting, I would say the consensus was that we needed an out of the cold shelter and we needed it now. But after the experiential learning process, and after about an hour and a half of this meeting, we left with everyone agreeing that we did not want another temporary shelter, that the answer was permanent housing, and that we would ask the Department of Social Development for 15 rent supplements, enough funding for 2 housing support positions in order to quickly house folks and avoid the need for an out-of-cold shelter. In order to determine who was going to get the rent supplements, we also decided to pilot a binding list. And 6 months later, this pilot project, which we called the Housing Blitz, transformed into our access system. And as part of that Housing Blitz, out of a goal of 15 people being housed, we actually ended up housing closer to 40. So when I think back on the barrier busting bash, the emergency meeting, the Housing Blitz, I think it was a really important moment for St. John for a couple of reasons. I think it reminded people that we don't need to do things a certain way simply because that's how it's been done in the past. And I think it also reminded folks that an emergency response doesn't have to be a temporary response, that we can respond quickly, but with permanent solutions. And this focus, this housing focused approach, has been really remarkably consistent since then, even as Marie pointed out, through the pandemic. So when we're facing challenges, as we are right now, of a growing number of folks with complex needs who, are high acuity, have been evicted several times, the response from the community isn't that these folks are unhousable, quote unquote. The response is, well, let's use this data to demonstrate the need for more diverse housing models, for supportive housing, for something that's going to meet the needs of these folks who clearly aren't being served by the current model. During the pandemic, when we're talking about isolation spaces, and of course we're talking about shelters and COVID shelters and accommodating isolation and social distancing, but we're also talking about permanent housing. Why, if we're talking about isolation, why aren't we talking about permanent housing? So it always comes back to housing. And when we're not being housing focused, if, in case conferencing, if it feels like we're not identifying next steps on the way to housing, that gets called out pretty quickly. And that happened very recently. So that brings me to the last part of the presentation, which is this In From the Cold campaign. It's a bit of deja vu. So, I talked about the Housing Blitz in 2018, 2019. So now it's November 2021. Once again, we're in a situation where winter's approaching. We see, at least anecdotally, we're seeing more rough sleeping. And so once again, we're in this position of some action needs to be taken. and what will it be? So again, as the community entity, we bring together some of the core frontline service providers, the shelters, Housing First, prevention, outreach, and we put the question to them, do we need an out of the cold shelter? And the answer was a resounding no. The in from the cold strategy was a concentrated effort to house 30 people before the holidays through the existing coordinated access process. So really ramp up, accelerate our efforts to house folks to once again avoid opening another shelter. The first step obviously is finding the housing. We drew on existing relationships with landlords, but we also developed some new relationships to quickly identify vacancies. And we took a different approach than we normally would, and we actually engaged a communications company, so people who know how to communicate, to help develop a campaign, to social media posts, to create a landing page, even to give some talking points. One of our primary landlord partners, who's been with us access, agreed to be kind of a spokesperson for the campaign. And so he spoke to media outlets. He was featured in our social media posts, and spoke very well from a Housing First perspective to encourage other landlords to reach out and to be part of this community effort, and to invest in permanent solutions to end homelessness. It was a very successful campaign, particularly in terms of garnering attention. It led to a large property management company reaching out with a request to do their own fundraising campaign in conjunction with From the Cold, which ultimately raised about $20,000 funding. So to allow us to provide them with a rent subsidy that would fill the gap until the time that the province could step in and continue the subsidy moving forward, which will be happening in April. Of course, when we're talking about housing, we're supports as well. And so in addition to finding this housing, we were able to beef up case management capacity at a couple of our coordinated access agencies through Reaching Home funding. And so that supported some of these moves. Ultimately, it was less than 2 months that the campaign ran. We housed 23 people before the holidays, with another 7 lined up for moves early in January 2022. And just to put it in context, because I haven't really given much data from St. John, but our average monthly moves are about 5.5. So when you consider almost 30 people in less than 2 months, it was an ambitious goal, but the fact that it was achieved, to me, really speaks to the hard work of the frontline agencies. I mean, Kathy really quarterbacked this thing, so I mean, kudos to her as well. But it was such a great effort. In addition to those move-ins, as I mentioned, more than $20,000 was raised to put toward rent subsidies. There were also other donations that were raised that contributed not only to the folks moving into housing, but also some supplies for the shelters. And then finally, new partnerships were developed. We presented to City Hall, to both council and senior city staff. And as a result of that, the Emergency Measures Organization partnered with us to create survival backpacks for folks who were sleeping rough. I don't want to overstate the extent to which the city has become engaged, but it's certainly more than we've seen in the past. And so that for us was a win as a result of this campaign. And then also, more generally speaking, I would say it led to an increased level of awareness in terms of kind of homelessness in general in St. John, but also awareness of the fact that there are a number of agencies working in a coordinated fashion on permanent solutions to homelessness. And really, I think, I would hope, educated the public a little bit more on the fact that we do have a coordinated process that is driving reductions in chronic homelessness. And so I think overall, the campaign was a big success for us. So that's all that I had for the presentation, Marie. So maybe I'll hand it back over to you.
Sure. Thanks, Michael. That's great. And sorry about the sound kind of cutting in and out, but we do have lots of questions, and I think you can help fill in any gaps if people were missing anything. So maybe I would just say and highlight for everybody, I think what we have seen in New Brunswick is that there has been great connections made with New Brunswick Housing, and having folks being able to access sort of subsidized housing through the provincial subsidized sort of community housing. And that really you've been more like working to lean into market rent landlords, which may be the reverse in some other communities. And so I think some people had, sort of questions about that. But people were asking about there's a bunch of questions and I'll get to all of them, but your barrier busting event, like how did you set that up? How did you know how to run that? Maybe you could say a bit more about that.
Sure. So this was it was a partnership. It was part of Making Zero Count, I think was the name of the project. It was really defining an end or achieving functional zero in chronic homelessness and how we could be doing that. So we were one of 5 communities that took part in that initiative. So we were supported through the COH. And basically what we did was we had a variety of different client profiles that people were assigned. And so it gave you, your age, your gender identity, your current living situation, some background, if you struggled with substance use disorder or mental health issues, but it would give you actual tasks of what you had to accomplish. So for some people, it was access an emergency shelter. For others, it was get in touch with the Department of Social Development. And what ended up happening was folks realized that before they could access one service, they were often missing some steps in between. So it could be something like, if you don't have identification, you're going to have to get that before you can, move on to the next step. But there was I think what's really helpful about the experience is it puts you in the frustrating position of not being able to move forward and not understanding why nobody communicated that information to you before you were turned away from a service, for example, or trying to access, an emergency shelter and then a Housing First program and being told you have a different intake form and a different assessment that you have to go through. So part of it is being bounced around and not having, a clear path to follow to housing. It also certainly touches on the fact that people were forced to tell their story over and over again every time they wanted to access a service. So all speaking to the benefit of having a coordinated access system in place where none of that has to be done. So I think what is so beneficial about it is you can put that down on paper. You can highlight, as we had done, the gaps in services, some of the policies that were particularly problematic. But what it does is it introduces the emotional component of being the one who is trying to access a service or trying to check things off your to-do list and not being able to get it done. So I think that's it. It was really successful for us. Myself and my colleague Chris Foreman also took part in a similar event on PEI in November of 2019, I think, which was also a huge success. That was also an introduction to coordinated access for the island. So it's a really, really great strategy, I think, for demonstrating the value of coordinated access.
Thanks, Michael. Sorry, I was trying to unmute. Yeah, system mapping, such a great way to identify issues and bottlenecks. And you had a really experiential event, which really takes it a step further and kind of sounds like you really gathered a broad base of group folks to participate in that.
Yeah.
So we have a question here. If you are using an emergency motel program, and if so, have you seen capacity changes as you've ramped up coordinated access? And maybe this speaks more broadly.
So we don't use an emergency.
Go ahead.
Sorry, go ahead, Mary.
Yeah.
We don't. I mean, there are occasions where an agency will put someone up in a motel temporarily, but it's not. I would say those instances are few and far between.
Okay. I had just a question about the communications company that you employed. Did they end up doing that pro bono, or did you invest a bit of money to kind of really make that happen?
We got a discount, so we invested a bit of money, but honestly, it was so valuable for us. I think communications is one of those things that, particularly as a nonprofit, it's usually the last thing on the list of priorities. And particularly for this campaign, I think because we were trying to engage folks from the general public, particularly landlords, but we were trying to reach beyond our core group of folks in the homelessness serving sector. It was really, really valuable for us to have that kind of expert advice on how to actually do that, how to maximize your impact. It was honestly just so nice to have people make things look pretty without having to worry about it ourselves. So yeah, I think they gave us a good deal, but we invested a bit of money, and I think it was well worth it for us.
That's great. And Michael, could you say a little bit more about some of the case conferencing you do? Like, I think you kind of have sort of a bit of a two-phase process and two groups. And I know some of your, you do some prioritizing and you're having some conversation at those tables. Just, yeah, how that works.
Yeah, so I can certainly speak at a high level to it. Full disclosure, I haven't been to a case conferencing meeting in about 2 years, but I'm certainly included in, like how things are adjusting. So what happened for us was initially our BNL meetings, we handled both policy and also matching clients to units. And after about a month, we found that it was too much for one meeting. And we also found that there wasn't always the right players around the table, particularly when we got to having conversations about clients and particular needs. So we then shifted to having a BNL meeting, which was often, executive directors or managers. And then it would transition into case conferencing, where case managers would come in with a bit more knowledge of the clients that were being discussed. Eventually, although folks still wanted to keep the vacancy matching and referral, so identifying available units and matching them to a program, they wanted to keep that at the BNL table. So we said, okay, we don't want to be getting into client discussions. We don't think that's an appropriate venue for those conversations. So what we try to do with case conferencing is provide a venue for, again, let's say the Housing First program, to bring the priority list and say, these are the top 5 individuals in terms of need right now. Does anyone have any essential information that we should be considering before reaching out to these folks? And then beyond that, case conferencing also provides a venue for folks to discuss particularly complex cases, to identify barriers that these folks are facing to housing and be very concrete in terms of possible solutions to those barriers, attaching actions to them, attaching, who owns that action, and even being so focused as to, really structure the time that's being allotted to each client. It's a really, really action-oriented meeting that really requires good facilitation. And so we have in St. John, my colleague Ben Appleby, who was the Housing First lead for a really long time. He keeps those meetings very structured and very action oriented. And so I think people find a lot of value in those meetings. But yeah, I guess just to kind of wrap that up, the intention of case conferencing, it is very connected to the BNL, and the purpose is always, again, housing focused. How are we progressing these folks closer to being document ready, to overcoming barriers, and to being attached to a unit?
That's great. Thanks so much, Michael. I see that Ben is actually on the call as well, and I tried to oh, not available because you're on an older version of Zoom. Sorry, Ben, I was trying to unmute you so you could talk, but I think there's an older version of Zoom going on that isn't allowing you to do that. But feel free to add anything else about coordinated access into the chat. There's a question here about whether you do separate case conferencing tables for youth and adults. But then I'm thinking that you don't, but maybe just speak a little bit how you might pay attention to both youth and adults.
Yeah, so at this point, it includes both youth and adults. So we do have some specific youth serving agencies around the table. We have had conversations about having a separate table for youth. There is one organization in St. John who has kind of taken a lead on that. But at this point, it's not to the level of having those kind of intensive case conferencing sessions.
Great. I am actually going to share my screen here. Michael, and oops, because I wanted to show people, I did put it into the chat. I put a couple of things into the chat. I put the Making the Zero Count resources. There's a number of resources, but one of them speaks to some of that engagement of folks into case conferencing and some of the exercise that you went through. Your website here for coordinated access has some great things on it. So there's your by name list sort of screening tool that you showed us. There is your coordinated access guide. So if anyone wanted to really dig into what's going on in St. John, there's a guide there that you can read more about. Looks like you have a portal or a place that people can click to provide updates. And I don't know if you want to say a little bit more about how that process works.
Yeah, so this again kind of goes back to our access points and trying to alleviate some of the burden that the primary access points were feeling. So we've always provided this kind of portal through our website for updates on clients. And then more recently, we also included the ability for folks to either self-refer or refer somebody that they're working with, somebody that they know who's experiencing homelessness. So you can do that through that link as well.
That's great. And then I wonder if you don't mind saying something about some of these new defining the data resources that you've been putting out.
Yeah, so this again, talking about hiring a communications firm, this is our own attempt to really improve our communications. I think what we find is that often we have multiple groups that kind of work on governance within the homeless system in St. John. We have the Built for Zero leadership team that uses a lot of, I think, jargon can sound like a negative term. I think it's really helpful terms, but I think we realize that when we're talking about something like functional zero, potentially even chronic homelessness, not everyone is understanding what we're talking about in those instances, particularly when we get to kind of more advocacy organizations that might not be as involved in coordinated access, but still have an interest in homelessness, potentially faith organizations or something like that. So the Defining the Data series is really an attempt to define in kind of easily digestible definitions. What are we talking about when we're talking about chronic homelessness, or why do we talk about chronic homelessness so much? why we used to just talk about homelessness. What's this chronic homelessness thing? When we're talking about functional zero, what does that mean? Why aren't we talking about ending homelessness? You know, and then veteran functional zero, well, what's the difference there? So this is really our attempt. This is part of a newsletter that goes out to everyone in coordinated access and then beyond, that not only highlights some success stories or some, you know, new programs in the community, but also tries to tackle some of those questions about what does that even mean.
That's great. We have some questions. Who's responsible for keeping the by name list client files up to date if the phone number changes, etc.?
So typically it would be who the person who referred the individual to the BNL. And so again, so this is, you know, updates are so important in terms of, and that comes down to a lot of work for the coordinated access facilitator, because sometimes it is tracking down when updates are needed on the client file. We are, as part of our shift now to coordinated access within Hyphas, we're really asking that those updates be provided through Hyphas, which has been done for quite a while now. Our BNL coordinators, not just in St. John, but in Moncton and Fredericton as well, do receive updates from Hyphas, which prevents them from having to track down, you know, case managers and take up a lot of their time. But yeah, so that's essentially, it's a bit of a hodgepodge at this point of how updates are provided, but we are moving toward all updates being done through Hyphas.
Okay. Amazing, which takes me to the Hyphas question, which is, how long have you had Hyphas? And, you know, I mean, I think that also goes back to, yeah, how have you been doing sort of Hyphas at the same time as keeping your by name list in Excel? And what does it mean kind of, and how do the agencies feel about moving everything now into Hyphas?
Yeah, really good question. So in terms of how long we've been using Hyphas, we implemented Hyphas 4 in 2019. It was a long process to get to that point. And agencies were, a lot of agencies in New Brunswick were using Hyphas 3.8 prior to that. Are people excited about this shift? I think that they are. I mean, we the real benefit, I think, for agencies of moving to the coordinated access module within Hyphas is that it eliminates the need for them to duplicate updates. So when we're talking about operating coordinated access and the BNL and Excel, and then Hyphas 4 in tandem or in parallel, there is a lot of duplication inherently. We knew that from the beginning, but people were, you know, saw the value in both, and so we're willing to do a bit of duplication. I think ultimately it will eliminate a lot of that work for the frontline agencies. It does just mean, you know, like the reason why I say we'll be moving in that direction in the coming year is that it means people need to be using Hyphas in a really reliable and consistent way. Because at this point, we have a lot more data on the BNLs in some ways than we do in Hyphas. Something like, you know, tracking chronic homelessness wasn't done for a long time in Hyphas. So housing history wasn't being filled in. And then you realize when you try to generate a unique identifier list in Hyphas, you have 9 chronically homeless individuals according to Hyphas, whereas according to the BNL, you have, you know, 75. So there's a discrepancy right now in terms of the data that we'll be working on in the coming months. But honestly, I think people are looking forward to having it all housed in one database. I probably didn't answer all the questions there, but
I think that was pretty good. I think, you know, what I'm hearing too is that you're making sure you can get out of Hyphas, you know, and that data aligns with what you've been kind of maintaining in your Excel by name list to support that switchover. And
yeah, absolutely.
So a question here about who's responsible for contacting the by name list client to match them with services or housing. So, you know, I guess someone add someone to the list, hopefully they remain contact and can update. But when it comes time to making that offer, who's doing that, doing the matching and the offering?
Yeah, so so as I mentioned in the vacancy matching and referral, we're always connecting an agency or a program to a particular unit. And so it would be that agency or that program. So again, if it's the Housing First team that's connected to the unit, they would receive the priority list of 5 individuals. And so they would be the ones to reach out to those clients. So we would, you know, if they weren't the primary contact before then, there would be some kind of warm handoff from the referring agency to the agency that will be providing the housing-based case management.
How many people in New Brunswick or St. John are waiting for rent geared to income? And or maybe how long are people on the list? Like, I think people are trying to get at, like, how big is this list? And is it kind of as big as it is in my community?
Yeah, well, it's a lot bigger than the BNL. So that the wait list for affordable housing in New Brunswick is thousands long. In the St. John region, I don't know right off the top of my head, but it would be probably 1,500 people. So when we're talking about the by name list, and that's people who are actively experiencing homelessness, we're talking closer to 117. But yeah, the wait list is extremely long for affordable housing in New Brunswick, and people wait years often.
And how is the by name list, or how do people get referred from the by name list to coordinated access? Is there sort of a priority or a way that folks who are experiencing homelessness are accessing those resources?
Are accessing like the rent subsidies, or
the rent subsidies or rent geared income housing? Yeah.
So it's all tied in at this point. Social development, kind of early on in the process back in 2019, really bought into coordinated access. So there's a certain number of rent supplements from that pool, you know, like people experiencing homelessness aren't competing with the 1,500 other folks in the region for rent supplements. There's a particular pool that's kind of handed over to the by name list. And so it's essentially left up to the community based on prioritization factors. Whoever rises to the top of the list and is matched to a unit, they are connected with a rent supplement from NB Housing.
That's great. And I just said that I've launched sort of our feedback poll so people can start to fill that out while we just continue to talk here. So approximately how many agencies are involved in housing programs? And, you know, just to make sure we're getting at that question, like how many agencies are kind of involved in your by name list work overall? And then how many maybe have more of a housing resource attached to them?
So at this point, there would probably be 4 agencies. So in the presentation, I said there was more than 15 agencies, programs, government departments that are involved in coordinated access. I would say about 4 or 5 of those have programs that are where they're specifically funded to house and support individuals. In terms of actual housing programs where your mandate is to support homeless individuals, we would have 3, I think. We have a Housing First program that supports high acuity individuals, and then a couple programs that support low to mid acuity. And so then the remaining programs would be something like Elizabeth Fry that has units where it might not all be people experiencing homelessness that are housed there, but they would try to reserve 1 or 2 of the units for the BNL. So they would support individuals when they're moved into those units.
That's great. I'd missed a couple of earlier questions about the rent subsidies and the money that you raised. And so it sounded like maybe all of that money kind of came from the one property management company. I'm not sure if you got other donations, but then folks were curious, yeah, if I've missed anything, who else kind of helped with that fund? And then how long did those rent subsidies last as you tried to bridge to, you know, rent geared income or other subsidies?
Yeah, so the 20,000 was from that one property management company, which was, I can't remember the exact time frame, but I think it was raised in a couple weeks. And so though those rent subsidies are still in place now, the province will take over come April in terms of subsidizing those individuals' rents. There were some other donations that came in, part of which were used to get people set up in their units. And then the rest were also donations for the shelters. So we didn't want, although we are housing focused, we recognize the essential role that shelters play, and our shelters are also very housing focused, but as part of the campaign, we didn't want to neglect that the shelters also had needs. And so that's some of the donations also went to supplies for the shelters for the winter months.
Thanks, Michael. I'm going to rapid fire just the last couple of questions. Like, when people are waiting on your by name list, where are they staying? Are they in emergency shelter? Do they tend to be, couch surfing, that kind of thing? Outside? I don't know if you have encampments.
Yep. Yeah. All three. Yeah, and plus. I mean, we try to have fairly clear guidelines for who should be added to the BNL, but and we have the screening tool that kind of gets at that. But the bottom line is always, if somebody is going to become imminently homeless, we want to know who they are. We want them to be on the list so that they can be prioritized. So the current sleeping arrangement. Certainly, a lot of folks are couch surfing if it's an unsafe situation. A lot of in emergency shelter, some sleeping rough. So yeah, kind of a combination of all those.
Then I have sort of a question, role of the service manager, and you really don't have that role like Ontario does in New Brunswick, but you folks are the coordinated, you're the community entity, and there'd be local cabs in each of your communities. But they're asking like the connection between the New Brunswick housing and yourselves. Is there a formal connection? Is it a referral connection? You're not connected together. You're two separate. You're a nonprofit, and New Brunswick housing is run by the province.
Yeah. So there's no real formal connection between the two, but we do coordinate very well together. As funders, as the community entity, we essentially function as the funder on behalf of the federal government. And so I think we're really lucky in that social development, the New Brunswick Department of Social Development, has bought into coordinated access, sees the value in being at the table and dedicating rent supplements to the process. And then beyond that, when we're talking about funding any other homelessness related activities, we also work very closely with them. So it's a good relationship. It's not one that is super formalized, but it's a good working relationship.
That's wonderful. Well, we are right at 2:00 here, and I'm sure people are having to pop off to head into other meetings. But Michael, thank you very much for your time and for answering all those questions. I'm seeing a lot of thanks a lot in the chat there. And again, this is being recorded, and we'll make sure to send it out to everyone who's on the call and who registered.
Awesome. Thanks, everyone.
Okay. Thanks, everyone. Bye.